So I wanted to, first of all, thank you all for joining the University of Georgia's College of Public Health Chat with a Changemaker. This is formally known as the Black Alumni Connection Series, and we decided to change the name. And the reason behind that is we wanted it to better reflect the college's commitment to inclusiveness, as well as really highlight the impact that our alums are making in the world today. And so our speaker today, Lou, definitely has made his mark in the world of public health, and I'm really excited to moderate our session today. So we're going to do a few brief introductions of our board. But before we do that, I did want to recognize our dean, Dr. Marcia Davis, and it's an honor to have you here with us today, Dr. Davis. Didn't know if you wanted to say hello or to say any words or anything, but we're really happy to have you join us today.
Well, I am thrilled to be here. Thank you all for joining us. And Lou, it's so good to see you. I think it has been almost...
No, don't say how many years, Marcia. We're at that point.
We are at that point, right?
Yeah, it's been a lot of years.
It's been a lot of years. But that baby you helped me raise is all grown up and doing really well.
Yeah. Okay, all right.
Thank you. I was an assistant professor at the time when Lou joined as our project as the research assistant, and helped me with that project, as well as my work-life balance, having a newborn at the time. So I am grateful to him on many fronts, and most grateful that you have remembered us and come back now to share lessons learned to all of us. So thank you.
Thank you, Dr. Davis. So I'm going to have our board introduce, just do very brief introductions. So board, you know how I am, like, just make it brief. So just tell us your name, the year you graduated, and your current title. And so I'll start. I'm Latanya McGinnis, class of 99, and I'm currently an assistant vice president at Aon. And so Erica, I'm going to kick it off to you.
Hi, everyone. I am Erica N. Parks, class of 2011, and I am the CEO and founder of Camouflage Me Not.
Thank you. Kim, are you on?
I am. Hey, I'm Kim Metcalf. I am president of Riverbend Environmental, and I'm Environmental Health Science 94 and Master's in 96.
Thank you. Meredith, you're up.
Hi, everyone. Good afternoon. Good evening. Thanks for being here, Lou. Very excited to hear you. I graduated in 96, and I'm the director of program and project management for our healthcare arm, specifically in the pharmacy benefit management space for Anthem, which is now called Elevance Health.
Thank you, Meredith.
Thank
Lori, you. Are you on?
Good evening. Lori Elmore, graduated in 2000, and I work at the Centers for Disease Control and Prevention, and I am a budget policy team lead in the Office of Appropriations.
Thank you, Lori. David. David, going once? Maybe he's running a little late. I know David is maybe in Oregon or here and there and everywhere. So, Nicole.
Hey, good evening. Can y'all hear me? Am I on?
Yes.
Okay, great.
Yep, you're on.
I'm trying to log onto my computer at the same time, but I'm on my cell phone right now. Good evening. I'm Nicole Hancock. I graduated in 1998 and formerly worked for Maximus Healthcare Consulting Company, but I'm currently the owner of a bakery. And I drive a bus for my daughter's old school. So, yeah.
Thank you, Nicole. Adam.
Hey all, Adam Bowling here. I'm a environmental health science major, currently out in Texas working as an attorney. So great to meet you all.
Thanks, Adam. Valerie. Valerie on. And last but certainly not least, Fabrice.
Hi, I'm Fabrice Julian, graduated in 2013 and currently an assistant professor at University of North Carolina, Asheville.
Thank you. I think I got everybody. Erica, I got everybody, right?
Yes, you got everybody.
Okay, awesome. And just a couple of housekeeping items before we kind of go into our discussion with Lou. Everyone just make sure that your audio is on mute. But if you do have questions, feel free to put them in the chat. Kim is monitoring the chat, so whenever questions arise, just go ahead and pop them in there, and we'll check in periodically with her for questions. So without further ado, I'm happy to introduce my friend, Dr. Lou Brewster, class of 2003. He is the Senior Executive Dean, Community Health Innovation at Roseman University of Health Sciences in Las Vegas. And so Lou, welcome. Thank you so much for speaking with us today. And you ready to get started?
Of course. I'm gonna make one correction. So I'm the Senior Executive Dean for the College of Medicine at Roseman University of Health Sciences. And so that's my reason for being out here. Yeah, exactly.
Sorry, I just, I could have just introduced you as Super Lou, but, I didn't.
No, you gotta, you know how it is. You have to make sure, all the attributions are in a row, or, you'll get a little call from upstairs. So you want to make sure you
For sure. Thank you. So let's get into it. So talk to us a little. Well, you told Lindsay and I you're traveling and you're in a safe at the moment. So hopefully you're all locked in good and.
Right. So I don't want people to think anything nefarious about what you just said. I am traveling currently. I'm in Reno, Nevada. And I'm here to do a presentation for a cancer summit here. And I found this shared workspace, and the quietest room they could give me is actually inside of a vault, which is a safe. It's some historic building called the Virgil. And apparently this building is part bank, part church. The front end of it, they transported from some army base and made the front of the building, and then the back of the building was an existing bank, and they kept the safe. And so I'm sitting literally inside the safe in a room doing this interview. So there's no link to what I'll do to have a conversation with you, Tanya, at this point.
Thank you. I appreciate that. Absolutely. The things that we do for the University of Georgia. Go Dogs. Exactly. So tell us, how did you first just become interested in public health?
Oh, wow. So actually I thought I was going to go to med school, right? So I along with a number of my friends from Morehouse, went to a program at Northwestern College of Medicine, got started in the summer. I didn't really like it. So I left and applied for a master's in nutrition at Georgia State University. And while I was there, I met my first mentor, Dr. Rebecca Mullis. She was the newly named dean for the Department of Nutrition. And while I was there, this is going to tell you how life comes full circle. So while I'm working for her, she says, hey, I have this former student of mine who I want you to go work with. She's a dynamo. You're going to learn so much from her. And that was Dr. Marcia Davis. You're our dean right now at the School of Public Health. And so, Marcia talks about my helping her, but, there is no way that I'm doing what it is that I'm doing and done without Dr. Davis, or as I know her, Marcia. Marcia, I can't begin to thank her for all of the different things that she showed me. Literally, I remember being at her home and her sitting me down and going through my assignment papers when I was at the University of Georgia. I remember in one in particular, I got a paper, I thought it was well done. And she was like, you know, we're gonna go through it. You're never gonna get a grade like this again for that paper, for these papers. And so she taught me the game of public health. And I think through that and through the program that she had me working on, which was NIFTY, Nutrition Intervention for Youth through, for families through youth. That's what it was, something like that. So I apologize, Marcia, if I chopped that up. But that part of it, they required me to kind of go out to schools, go do home visits, etc. And I had one particular episode during that time, to get to your question. I went to visit this one woman. We had incentives that we would give to families who would participate in the videos and stuff like that. But they had to fill out like a 5-a-day survey. So I went to visit this one woman, and she did the 5-a-day survey. I'm asking her about fruits and vegetables, but her lights are cut off. And so I'm sick. I'll never forget this. And I've told so many people this story. I go to her house. I'm like, hey, well, I'll come back, because I'm thinking it's too dark for her to be able to fill out this survey. She's like, no. I need that incentive. I need that money to pay my light bill. So you're not going nowhere. So she was like, we're gonna open this door and you're gonna talk to me. And I've never done a survey so fast, because I was literally racing the sun going down. And but at the same time, I remember on the way home thinking to myself that we were missing something, right? Like here I am asking this woman about fruits and vegetables, and I couldn't do anything about, her circumstances more globally. And, this kind of predated a lot of what we were doing around what we now call the social determinants of health. But that really resonated with me because, I grew up in the Bronx in New York. I had family and friends and their families who had similar circumstances. And I just felt like that was my calling. Like I had to do something to help individuals who were like that, because absent of myself, and I kind of view things that way, absent of myself, who else is going to do it? Because it's been existing this long. If I don't do nothing, then what's to say somebody else is going to come along and do something different? So that's kind of how I fell into public health and kind of fell out of it because I've only had one job in a school of public health. Despite everything I've done, I've been at Michigan. I was in the School of Social Work. I spent 2.5 years in the School of Public Health, founding the School of Public Health at Florida International University, and then I went straight into medical schools, and I never went back.
Mm-hmm. Well, thank you. I feel like a lot of us start out as wanting to be doctors and lawyers and things like that. And, public health is always a good path for those of us who, kind of wanted to go on that medical career. But like for me, I saw the prevention piece. And so that was, kind of the public health appeal to me, to kind of get to people before they got to that stage to where I could help them as a doctor. So talk to us a little bit, like you talked briefly about a couple of things that you've kind of worked on, but for the students that we may have on the line or alumni who, may be thinking of other career options, can you walk us through kind of the progression of being a student, of your career from being a student to your current role? And I know it may take a little bit, so maybe the abbreviated version of, of that. Yeah.
So So I'm kind of a blend of entrepreneurship and academic. And so I've never really been one or the other. And to be honest with you, I've always kind of viewed my career sort of like a portfolio career. I've had multiple things I've done in my life. They've always, however, been about helping disenfranchised groups. I don't do work without it having some benefit to groups that are underserved or marginalized. that's just sort of a commitment I made. I got sick early in my 20s, ended up in a coma. And I always told people, during that time when I was kind of laid up, I felt like I had a conversation with God and made a promise that, I wouldn't do any work that was just about me, that was just about making money. Up until then, I would say I was really about that. I really wanted to sort of self-ingratiate myself and indulge only for myself. Coming out of that, I felt something different. And so I kind of set out on a journey. I started a consulting firm in Harlem. I was working to make business sense of helping people, basically. So I work with like a huge board of millionaires in Harlem to help them figure out how to help individuals in the community. And a lot of times, a lot of the issues they were facing were public health issues. And so embedding those that programming into their economic development and community development schemes to help them monetize doing good for people, basically. And so then I got a phone call during that time from Stu Forrest, who was the dean at the time of the School of Public Health. And he was like, hey, man, if you still want to get this PhD, I'm about to retire. You better hurry up. And so I did. And it just so happened that coincided with 9/11, and I had some business issues around the finances I was using in 9/11. So I finished up, and then I went in, ended up at the University of Michigan. My wife had a postdoc at the University of Michigan, so I went and did some work as a research manager at the University of Michigan. That was a great experience. And then when I had the firm in New York, I had sent a letter to a person in England telling her, if you ever have an opportunity for me, I'll pick up and go there because, I love the work she did. So while I'm at Michigan, she sends me a letter and says, hey, I got a spot for you. If you're still serious, come on by and come to England. So I moved to England. Me and my wife moved to England. And I did a project doing health impact assessment for Arsenal football team, which is like the Yankees of football in London. And that was a really great experience. Before I left, though, I got called for an interview for a new school of public health that was being founded in Miami. And the dean was like, hey, I heard your work. I really want you to come and be an anchor of our community work here at that School of Public Health. So I was like, look, I'm going to London. He was like, no problem. I'll store your stuff while you're going. He never asked me how long I was going, nothing. He just said, I'm gonna store your stuff. So I went to England and I did my work there and came back, took the job in public health. Didn't like it after a while. I didn't feel as though they were committed to true community work. And so my wife and I made a commitment that we were not going to do fluff public health. And we were going to go all in, like, you only live once. And so we were going to leave. And then I met this crazy man, Joe Greer. And he was like, look, we're doing a new college of medicine. And we have this idea of training medical students by doing home visits. And I was like, I gave my 2 cents about, some of the challenges with doing that. And he was like, well, since you know that much, why don't you come and put this thing together for me? And then 17 years later, thousands of households cared for. It just turned into a phenomenon. And then we were brought out here to Las Vegas to recreate it for this school out here in Vegas. But I've just been, really blessed in my career because I've had great people to work with. I say but there's so many people. I couldn't do my work here in Vegas without, some of the people, Shayla Pierre, all these different people that they came out here. So yeah, it's been fun. It's been a fun ride. Very fun ride.
It's been quite a journey. Definitely quite a journey for you.
And I left out a lot, but that's the bulk of it.
Yeah, and I do have a couple of questions about your time in London, you know, kind of from a global public health perspective, but I do want to kind of stay on like what you're doing now. So talk to us a little bit about the Genesis program and, you know, some of the things that you're doing around social determinants of health and health equity and disparities in the work that you're doing out there in Vegas.
Right. So to go to that, I got to go back a little because this initiative out here is based on the work that we did in Miami, a program called Green Family Foundation Neighborhood Health. The basic concept is this. It's about training interprofessional teams to work together to help low-income, medically underserved communities. And so we all know, I shared with you the story of doing that home visit. A lot of what we put together was in direct response to that. I always tell people that putting that program together, so in essence, what we did was we put medical students in teams, and these teams would have social work students, nursing students, School of Social Work students, law students, and they would work as a team to improve not only their health, but the social quality of life for the household that they were assigned to. And the medical student is working with that household for 4 years of their training, which is all of their training, to improve the health and social outcomes of those households. In addition to that, though, they are supported by a team of lay health workers or community health workers, not, you know, whatever you want to call it. And they basically provide the continuity of services when the students are unavailable. Students are students. They have to take tests and do all those things. So as a function of that, I worked to kind of create a model of lay health workers that was an intervention of itself. So in addition to hiring individuals from the communities that we were recruiting households from, we spent an enormous amount of time trying to work with them. I preferentially hired them without college degrees. So I wanted to make sure they didn't, because, you know, all of the literature says that, you know, individuals in those communities who have college degrees are going to be all right in the long run. But the people who didn't really, so that's where you saw your most intergenerational poverty and despair. And so my thought process was to bring those individuals in and then work to build esteem, et cetera, and get them to avail themselves of a free, relatively free college education at the university as a function of working with me. And so I'm very proud of how many people we were able to get college degrees through that process. Some are still working, even though I'm gone and graduating. And so all of that we're now taking and bringing to Vegas. But instead of it being called Neighborhood Health, I chose to call it Genesis because I felt like Genesis gave me more freedom to do some more creative things that I couldn't do under the name Neighborhood Health. And so some of the stuff we're doing here is we're still doing the home visits. We're still going to have interprofessional teams, but we're going to connect it to a federally qualified health center. There's a much more robust element of technology, because one of the things that I also worked on when I was in Miami was building a prototype of a platform that made doing the work of community health workers more predictable and more precise. And so when I left, I commercialized that with my partners. That platform turned it into a commercial platform called Humble. And so that platform powers the work that I do out here now in Vegas with Genesis. So the Genesis app or platform is a white label version of the Humble platform. And so that's a whole nother venture that goes on. And then we got a bunch of electric vehicles for the employees, so that we could make sure that they have reliable and affordable transportation to do these home visits. That's something that I wasn't able to fulfill in South Florida, but I'm able to do out here. Then I had an idea to wrap those vehicles in limited edition art to kind of bring art and science together in a more formal way. And so these vehicles are designed with limited edition art that has a theme rooted in one of the social determinants of health. And so then there's like a whole big thing we're going to do around that, create a Genesis zone, which will be a fully Wi-Fi enabled area, 6 areas in Las Vegas that will be where we'll do home visits and have Wi-Fi enabled free Wi-Fi for households to access when we're doing our services, et cetera. And so just a lot of stuff. And we work in rural areas and urban, and the list goes on and on. So that's some of the
so cool.
Yeah, that's some of
It's so cool. I want to come out and see those wrapped vehicles.
So that is something that I'm looking. One of the things that I want to do is I want to make public health. I want to make it just a normal part of life. I want people to. I want to invite people out after a while. We have 42 million people who come to the Strip each year, and so I want to get some of those people to get on buses and come and tour Genesis zones and learn about what we're doing and how we're doing it, and see if they can build on top of them, build on top of the concepts that the infrastructure we're already building. I have this thing I'm launching with this aerospace company in Albuquerque called Amplify Nevada, and that's about training local residents in these communities to learn how to do today's version of manufacturing. And so when I was training, the only community I had to be concerned about was the offline community, the community you could see, feel, and touch. Today, I have to be just as adept at understanding the online community, the digital community. And so likewise, I try now to embed in all the strategies solutions that will be translated to the online space and the offline, and not ever have anything that's only occupying one or the other spaces. And so with this Amplify Nevada, I want to bring people in. I want to teach them how to manufacture in the modern day of manufacturing, but I also want to teach them how to buy land in the metaverse, how to work with digital twins to create new spaces, collaborate with people all over the world to build new physical spaces. Those are things that can help these low-income communities leapfrog in their financial, their lack of financial or social mobility by getting a new trade that doesn't require as much financial input, whether it be college or otherwise, for them to make some progress. And that's a tremendous hurdle that we find when we're dealing with the households that we visit. And so it's just about continuing to create, build more people, bring new talent here. I'm always looking for talent, people who want to work, real workers. No, like, don't tell me what you're about to do. Don't tell me what you're about to do. Oh, I can't stand a student who comes to me and tells me what they're about to do. Oh man, I can't stand that. I had you'll appreciate this, Dr. I had a student tell me, Dr. Brewster, I'm gonna start this consulting company, and we're gonna do, we're gonna help get people signed up for Medicaid. And I was like, okay, cool. What's the name of it? Oh, well, I don't have. Well, if you don't have a name for it, that's free. That don't take no effort. That don't take no. You know what I'm saying? Like, don't bow to be nothing. Like, tell me if you really are about it, then do it. And so and so that's the big piece. That's the big piece on what I'm hoping new people in public health are about is understanding that you don't have to wait on anything. When I was coming through, I had to wait. I had to wait my turn. You don't have to do that nowadays. These kids can come out and they can create their own public health intervention as long as it's rooted in some science. Like, don't go out there and be reckless with people's lives. But you have tools that we never had to create change like none other.
Yeah, I agree.
LaTanya, we're just to kind of give you a little update on the chat. We are just getting tons of not questions but comments about especially Erica, don't talk about it, be about it. That, the losing inspiration, that his creative approach for reaching these hard to reach areas. So again, no questions yet for you, Lou, but we are definitely getting a lot of comments just on the energy that you have and the creative approach that you have taken to public health. It's inspirational and fascinating. I'm absolutely loving this too.
Well, I don't know, I can't remember the exact professor that told me, and I feel bad about that, but I had a professor tell me once, if you want to be really good at public health, you should always work from the direction that people don't care about health. If you understand that concept, then you'll understand that you have to, in some ways, sell public health. You have to persuade individuals to understand, and you have to put it in a way that draws real meaning for them. If you're just going to do it, just roll out some cookie cutter program, you can't be upset that a person won't digest it. They don't owe you anything, and so that's why I say, a lot of what goes on is not about me, right? There's a lot of language we use that doesn't empower us to have the right mindset when we're doing public health. When we were doing work in Miami, the docs had this term dropout for households that didn't participate in the program anymore. And I was like, I remember talking to the team and I was like, they're not dropping out, they're just not ready, right? You got to think of it from a more positive standpoint. They're just not ready. Everybody's not ready for everything. It's like you can't call yourself special if everybody does what you do. So likewise, everybody's not going to be ready to conquer the same level of services and change in their life at the same time. And so what we would see is that a person may not be ready right now, but they'll come back to the program maybe in a couple months or a year. So why call them dropouts? They're not dropouts. They're not ready. Imagine if we adopted that approach in so many other systems we have in society. Imagine instead of calling a high school student a dropout, we say he's just not ready to complete his studies right now. Let him live, come back. What's the race anyway? I never understood that. Like, at the end of the day, isn't it just to become educated? If it takes me 20 years or 15 or 12, what does it matter? And so it's about changing our mindset. And so one of the things I really loved about the challenge in Miami, which really kept me there, was that for the first time, I wasn't working on a project that had 5-year, 3-year limits. Most of the work in public health when I was first starting out was grant funded for 5 years or 3 years, et cetera. So it makes you think differently. So imagine, I ask everybody, imagine if you, in the work you do, beyond public health, anything you do, imagine if you knew that there was no end date. How would you approach it differently? And that's how we changed. We changed by thinking differently about the confines, these arbitrary rules that are placed around us in working with communities. And so now it wasn't about collecting a bunch of data in a household. My only requirement to my team when they went out to do home visits, and still is today, is that you can go back again. If you can go back again, then we can always get data. We can always do whatever we want to. One of the proudest things one of the things I'm most proud of that we did in South Florida was this firearm safety sessions. What we would do is that if we went into a household and we found out that they had a legal firearm, we would send our police officer, because I had a squadron of police officers also in the program down there. I learned that because I took a trip and I met this researcher in France, in Paris, the Parc de Belite, and he was doing these creative programs around law enforcement. So I adapted some of it, and we started doing some stuff around health and safety. I had a tremendous Robert Leal, this police officer, the first one I had, did some creative work around firearm safety. But we would hand out firearm locks for free of charge to whoever had a firearm. And this was the same community that Trayvon Martin came from. So imagine, how is it that we were told we weren't going to be able to do it, send police officers into the households in these communities. Well, we did, we still do. It's because people trust us, and that's the social determinant of health that we never talk about. There should be a whole class in public health about trust and trust building, because nothing else happens without that. And so, yeah, it's just I love this. I love this whole space of what we call public health, but in actuality, it's so many other fields brought together. But yeah, I just love it. I love this work. I don't think I could ever stop.
Hi, I wanted to interject for just a second, just to share with the group. Well, first of all, I lead the Office of Development and Alumni Relations for the College of Public Health. And I just wanted to let everybody know that we actually just recently established in 2021 a certificate of social determinants of health. And it's through our Health Equity Hub, which is also a new program. But I'm so excited that you're talking about this because it has been discovered as such an important part of public health that really needs attention. So it's exciting that we have this new certificate and that you're sharing all of this. And I just wanted to bridge those two thoughts. So thank you.
Yeah, the platform I was telling you about, Humble, that we put together, one of the core elements of it is our ability to track the social determinants of health longitudinally instead of point in time. You know, the way I kind of describe it is that when you go to the doctor, every time you go to the doctor, they take your blood pressure, right? But oftentimes when you go to the doctor, they ask you if you have a job the first time, and they never ask you again. They ask you, most of the social questions they ask you the first time you visit, and they're never asked again. And so what we did is, using lay health workers, is we created a platform that allowed you to track the social determinants of health longitudinally, month over month. And we began to see trends that allowed us to create household typologies that change the way in which you see, quote unquote, a patient. The second thing is that the platform allows you to, and the whole work that we do has this concept called household-centered care. So anybody in that household gets services, no matter their insurance status, their familial relationship. If you live in that household, then you get care, you get services from us. And we track that at both. So we track social determinants of health both at the household level and the patient level simultaneously using that platform. And that's sort of, I could talk a whole day about that, but that's, so I'm glad that y'all are doing that. That's great. But, I'll tell you one thing that, I hope is being done is that we can't forget the public in public health. One of the reasons why I left the School of Public Health that I did work in is that I found that many of the people who had grants, community-based participatory research grants, all kinds of community health disparities grants, when you asked them if they had even been to the neighborhoods that they were studying, they would say no. Never been there, never had a cup of coffee there, never anything. And so it became an office full of individuals with closed doors that were talking about public health, but there was no public because they never interacted with it. And so all of a sudden you began to see recommendations and et cetera that didn't make sense. That's not to demonize public health. That's to say that's the areas of growth. That's where this, a new group of, or new crop of individuals should be able to come in and address those matters, right? Make it more experiential, bring it back to its origins of anthropology, sociology. When I was training, even at UAGA, we were reading Durkheim and taking, classes, yeah, right? And so we weren't getting the filtered down theory. We were actually reading the source of the theory that became the Bandoras and et cetera. And so I'm a big proponent of that. I think now I spend maybe like 90 minutes a year teaching because to me, you want to learn, you got to come out in the field, get in a household with us and see what it's really about.
Yeah, look, I mean, you should see. I know you're talking, but the comments and the chat is just going off right now with so many wonderful things talking about the Brewsterisms and all of the, all of the like the passion that you have, behind what you're doing. And you've really like mastered the art of combining entrepreneurialism to public health. Talk to us a little bit about, kind of some stumbles you've made along the way, like how you overcame them, just like advice for those who, may be wanting to do the same.
Yeah, so, I don't acknowledge a lot of, stumbles, to be very honest with you. I at this point in my life, I see my circumstances as successes and pre-successes. And so what I guess somebody would call mistakes or errors or challenges, I call pre-successes, because those things are rooted in the things I need to gain success, right? So why would I look down on that? I guess one example I would give is I remember I was just hell bent on starting walking clubs in Miami, and they were just failing. And I kept sending the team out, and some of them are probably logged on now, laughing at me right now about going out and trying to get these walking clubs together. And so that one didn't go over. But what I learned from it was that walking clubs was not a bad idea. It just was inappropriate. So there weren't good and bad ideas. There were appropriate and inappropriate ideas. The timing, the community, the needs didn't line up with what I was putting out on the street. And so it taught me, and that mistake happened very early in the process of growing that program. That process got me to learn that I had to spend more time focused on identifying those things, those timing elements, those like really understanding what's going on before I put something on the street. And then also it taught me that we're only going to go as far as the team is inspired by me to do the work that they do. I sort of, my team, I used to tell them I try to take the fireman approach, right? It's always been amazing to me that a fire chief stands outside the fire. Everybody who works for him lines up behind him and he says, go run in that building that's on fire, and they do it, right? They do it without hesitation. But hey, I'm standing out here. Tell me, I'll be here when you get back, right? Like think about what that means, right? And so, but the reason they do it is because of what was instilled in them. He gave them a mission and a message that was greater than themselves. And so for us to address and conquer some of the most daunting elements of public health, which are at the same time some of the most daunting elements of society, we need individuals.
Yeah, exactly true. So let's see. I have a few additional questions, but I have about 13 minutes left. So I do want to pause for a second here to see if anyone in the audience has any questions or anything that you want to address with Lou before I ask him a couple more questions before we go. Kim, is there anything in the chat question-wise?
No, I think our chat box is just on fire with just more comments and questions, and
speaking with the fireman example, yeah.
I think Lou's passion is contagious, and I think we are all just super excited about what we're hearing from him, and this has been fantastic. So, but yeah, we are coming in on time and need to make sure we leave a couple minutes at the end for Erica to close us out.
Can I share one more thing? I just want to share one more thing. Okay. So when my mother was in college, she was very active in the 60s movement and got herself in a lot of trouble. She grew up in Savannah, Georgia. And they asked her to leave not only the college, but the state of Georgia. And my mother, when I was a child, would tell me and my sisters, that her mission was to see to it that her kids all graduate from college in Georgia as a way of sort of thumbing her nose at the people who made her leave her beloved state of Georgia. I think, it's incredible to me just to tell you how life is full circle and how you can bring the fullness of yourself to your passion and that's the true meaning of change. Here it is now, 52 years later, and she has a son who is doing a presentation at the University of Georgia, the School of Georgia, with the word changemaker associated with it. So my mom was demonized for trying to be a change maker, right, in the 60s and put out of the state just to have her son 52 years later be a change maker and be celebrated for it. That to me is why I do the work I do, because it's all about that, right? It's all about that. And so thank y'all so much. Thank you, UGA. Thank you, alumni. Thank you, everyone, for this opportunity. You will never understand how much it means to me today to be able to complete that circle for my mom.
I love it. That's such a great story. And you have such great advice and so much experience and have learned so much from, graduating, even before starting University of Georgia and all the work that you've been doing in public health. What advice, would you give our students as they are, making career choices and kind of deciding what they want to do with the rest of their life? What advice would you give them? And if you want to kind of pepper in a little bit, some of the things that your preparation and your education at the University of Georgia, has helped you, throw that in there as well for our students.
Okay, real straightforward. I could summarize my path in 4 steps. Everything I've done, everything I will do, anything that has been celebrated, it's always been the same path: sacrifice, doubt, restored faith, blessing. So if you want something, you're going to follow those steps or some amalgamation of it, or some manifestation of it. And so you have to find your path, your steps, but that's mine, right? No matter what I do, I have to go into it knowing that it comes first with some sacrifice, whether it be time, money, risk, you name it. But the bigger that sacrifice, the bigger the blessing oftentimes I will yield. And so doubt is natural. You have to get comfortable in doubt. You're going to sacrifice and you're going to get to a point where you're going to wonder, man, was it really worth it? But here's the biggest part. You got to surround yourself with people who will help you restore your faith. If you're sitting around a bunch of people who are going to doubt, who are going to give you all the negative opinion, etc., they're not a tool to help you restore your faith. You got to rid yourself of that, shed yourself of that burden so that you can realize your blessing. And then, that's that. And I don't care what you do in public health, there's going to be a path similar to that. And your University of Georgia, what it helped me do most of all, University of Georgia taught me how to feel comfortable with my skills. I remember when I finished my PhD, I told my dad, we're standing in a hotel in downtown Athens, and he said, how you feel? I said, I just want you to know 2 things. One, I feel so ready to do what it is that I have in the pit of my stomach that I want to do in this world. And I attribute a great deal of that to what I got, training at the University of Georgia. The second was, I hated every single day of school, Dad.
Every day?
Every single day.
You spent a lot of time in school.
Oh my God, I hope my son is not watching. I never wanted him to hear that, but I did. And so my dad said to me, if this is what you do when you hate something, I can't wait to see what you do when you love it. And so the rest, is what it is.
I love it. I love it. So I want to see if there are any additional or any questions before I hand it over to Erica. I know we did have one. Reverend Dante Quick did ask what role race plays in this. And I think in this, maybe he was when we were talking about social determinants of health and health equity. Do you want to address that real quick?
Yeah. So early in my career, just to be very frank, the whether intended or otherwise, the path was that the role that people of color played in doing this work was they were the field workers. They were the people who went out and interacted with the community. And all of the scientists and the professors and the high-paid and players in this game were white, just to be very honest with you. And so I always say that, we have to be more assertive, but also we have to demand at times that individuals who want to, quote unquote, help communities of color actually interact and go to communities of color. If you do not reduce the distance between those who are providing services and those who are consuming it, then you're going to end up with the same old mess of assumptions that continue to be had. And so we have to be, as people of color, more assertive in, and especially if you've reached a certain level in your career, that you have to interact with the people that you're helping. You can't just lazily farm the work out to somebody else, send somebody else out into the community and say, yeah, I'm out there. And that to me is very dear to me. Like you can't just phone it in no more. And we need more scientists getting, we need more people of color who are scientists getting research grants from NIH and these big places and government agencies. We can't be passive about that as well. But most importantly, we have to assign and ascribe a responsibility to help people in their totality, not just see them as the function or the object of our work. So what? I do public health. That does not eliminate my need and my responsibility to help them as human beings. There are no limits. There are no hard lines on what I do because I'm a public health practitioner and what somebody else is supposed to do. That's where race to me plays a role.
Thank you. Wow, this has been fantastic. So I want to thank you, my friend, for agreeing to talk to us today and indulging me in questions and our prep beforehand. It's been a pleasure, like reconnecting with you. And, as you can see in the chat, like everybody else is just as excited and inspired by you as I was and have always been. And, just thank you so much for sharing your story and your path. I'm sure we could talk for hours and people would continue to engage because, again, you're just so passionate about everything that you're doing and have so many things to teach us all. But thank you so much, Lou, for today. And